assume. And Mr. Speaker, we often hear it said that life is a multiple of threes. And here we are, the third time passing this important legislation. Now, you know, 100 years ago, this country was in the midst of the worst pandemic in its history, claiming the lives of almost 700,000 Americans and killing more than 50 million people worldwide. As we discuss the Pandemic and All-Hazard Preparedness and Advancing Innovation Act of 2019, it is paramount that we remember the significance of the centennial anniversary of the 1918 influenza pandemic. I must also note that, again, the third time the House has passed this legislation, we've clearly done our work, and it is time for the other body to do their work and send this bill to the President's desk. The creation of the Assistant Secretary for Preparedness and Response under the original legislation in 2006 has helped us to make monumental strides in preparedness, coordination, and response. Close collaboration and efforts between the Centers for Disease Control and Prevention, the Food and Drug Administration, and our state, local, tribal, and territorial public health partners has been vital in making this progress. Like politics, much of public health is local and executed on the ground by our hospitals, by our health departments, our emergency responders, who are our front lines in addressing infectious diseases, disasters, and threats. We hear each and every year of the dangers of the influenza as flu season wreaks havoc on communities across the country. Last year in North Texas, some schools had to close in order to contain the spread of the flu. This bill includes an important provision dedicated to preparing for pandemic influenza to protect our nation against the terror of a pandemic. And Mr. Speaker, I would just parenthetically add that if anyone has not yet had their influenza immunization this year, it is still a good idea to avail yourself of that protective measure. The flu vaccine not only can prevent the flu, but if someone gets the flu after having had the flu vaccine, their clinical course is likely to be more benign. This reauthorization includes an important provision, the Mission Zero Act. The Mission Zero Act seeks to connect American patients with battle-tested trauma care through the craft of military trauma care providers. The bill provides grants to integrate military trauma care providers and teams into the nation's leading trauma centers and systems. This will also ensure that our military can maintain battlefield-ready trauma care providers in between periods of active engagement. The need for top-notch trauma care extends across our nation, far removed from the battlefield. We must also remember that infectious diseases are a much more serious threat in the global community, and we must continue to ensure that we are prepared and ready to respond. Frontline facilities and responders in Dallas, Texas experienced this firsthand in 2014 when a patient presented with Ebola in a DFW emergency department. Today, currently, right now, there is an Ebola outbreak in the Democratic Republic of Congo that has been deemed the second worst on record with more than 600 cases. This legislation equips our nation with the tools to respond in a timely and effective manner when the public health and safety are at risk, such as if Ebola were to hit the United States again. Additionally, this bill will also help to bring domestic biologic surveillance systems up to date so that they are operating with the most efficient capabilities and technologies. We must also look for innovative ways to continue to advance medical countermeasures, ensuring that Americans can access medications that will provide critical protection in the future. Another portion of this legislation would modernize the regulation of over-the-counter medicines. To date, consumers have access to more than 300,000 non-prescription items, from cough to cold medicines to antiperspirants, antacids, and sunscreens. Pharmacy aisles and medicine cabinets are filled with over-the-counter products, and American consumers rely on these each and every day. This bill would make the over-the-counter regulatory framework more science-based and responsive to public health concerns and encourage the development of more innovative products and provide resources to the Food and Drug Administration to bolster the agency's ability to review over-the-counter applications and to regulate this sector in a consistent manner. The pandemic all-hazard preparedness reauthorization is critical to protecting the lives of all Americans and providing the necessary tools and infrastructure are in place when disaster strikes. I want to thank Representatives Susan Brooks and Anna Eshoo for their work, and the Representatives Bob Blatta and Diana DeGette for their work on the over-the-counter monograph reform. I strongly support this legislation, urge members to do the same, and I reserve the balance of my time.
The gentleman reserves the gentleman.